Marijuana is a drug that we're all familiar with. From famous icons such as Cheech and Chong to the increased medicinal use and legalization from state to state, marijuana has always been prevalent, and with the changing times is becoming more and more mainstream. Despite marijuana being a relatively harmless and beneficial drug, it is still federally illegal. This can have many implications, some of which may be damning. The lack of federal legalization increases risk in users in non-legal states, as well as preventing those who need an alternative medicine from obtaining it. When marijuana is consumed, it affects the endocannabinoid system, which runs all throughout your body and is involved in multiple processes from pain, memory, mood, appetite, inflammation, and overall neurological function. When marijuana is introduced, it can affect all of these systems in a positive or negative way. In medicine, there are two categories. There is medicine of the body and medicine of the brain. First, looking into medicine of the body, according to the National Library of Medicine, the biggest use for medicinal marijuana is in pain management. This can be greatly beneficial to patients with HIV or cancer or any other chronic pain. Marijuana decreases pain in HIV sufferers, but can also help decrease nausea in those undergoing chemo. When marijuana is consumed, it increases your blood vessels and decreases blood pressure, especially in the eyes, which can be greatly beneficial to glaucoma patients. As with any drug, there are going to be side effects, such as a dry mouth, increased appetite, potentially increased anxiety and dizziness, and a lack of motivation. Shifting into psychiatrics or medicine of the brain, because marijuana is still illegal, it is also classed as a first-class drug with meth and heroin, meaning that in order to do psychological research, there are a lot more hoops to jump through, and there just isn't enough to fully deduce a yes or no. However, a study done by Med-Surg Nursing stated that marijuana was able to help with some symptoms in schizophrenia and dementia. However, it had the potential to make other symptoms worse. The biggest use of medicinal marijuana in psychiatrics is with depression and anxiety. This can also have mixed effects, as marijuana can make anxiety better, but it can also make it worse. It has great potential to help those in a depressed state out for a little bit. However, it can also decrease their motivation to continue their treatments and making their depression worse. However, it is all dependent on the individual. I have a panic disorder with depressive tendencies, and marijuana has been a saving grace to me. With lots of trial and error, I have found a way to use it and have a healthy relationship medicinally and recreationally and not let it affect my daily practices. Shifting into recreational uses, the NCPD says that marijuana is the third most used drug right behind alcohol and tobacco. Alcohol and tobacco can kill up to over 100,000 people a year annually in the US, whereas marijuana has 0 deaths to date. This has a great implication that marijuana is a way better recreational option than alcohol and tobacco. Drugs are also a tale as old as time, and regardless of legality, individuals, especially adolescents and young college students, are going to find a way to consume. When buying marijuana off the streets, although slim, there is still a potential that you will get something that is laced. As with any illicit drug, there has been an increasing trend in lacing with fentanyl. Marijuana can be consumed in a high amount and a high frequency depending on the individual and their tolerance. This visual is the lethal dose of fentanyl compared to a penny. If enough cannabis is consumed that has been sprayed with fentanyl, an overdose is likely and recovery is not. By making it federally legal, it puts out a product that, when obtained by individuals who shouldn't have it, which is inevitable, it is going to make it safer for them and decrease the risk of being laced by fentanyl significantly. Now, not only can a federal code help reduce contaminants in street weed, it can also help with medicinal. As there is no federal code putting everyone on the same, there is a higher risk of contaminants such as pesticides. A study done by the Environmental Health Perspective pinpointed one dispensary and found that 2.3% of their flour and 9.6% of their concentrates contained pesticides. While this may not be an issue for individuals with healthy immune systems, it can be damning to medicinal users, such as those with HIV and cancer, where their immune system is already hindered. It could make their condition severely worse. With any drug, there are also going to be downsides, the first of which being under psychiatric medicine. According to my therapist, who is an LCSW in the state of Idaho, she explained to me that having a all or nothing response all at once can lead to addiction and dependency rather than using the drug as a medicinal benefit. However, my counter to my therapist and to all of you is that it is, again, dependent on the individual, as there were times where I was using marijuana to numb out the pain and not face my problems. I have found through trial and error a means to successfully go to school and be self-employed while using marijuana medicinally and recreationally. However, the one that is not dependent on the individual is the increase of prenatal consumption during or in legal states. According to SAMHSA.org and MJ Life Science, the increased positive perception as well as easy access has increased the use of prenatal marijuana. And this can have similar effects as other pterogens, such as effects on cognitive development and increased risk for miscarriage and stillbirth. In conclusion, marijuana is a highly used drug that is a safer option for recreation and a better alternative for those who may need it, rather than relying on painkillers which may damage the liver. It also reduces risk of all users and makes it accessible to anyone and everyone who may need it. Marijuana builds a community unlike any other, and any public event that you go to, you're going to see someone advocating, possibly in a group, for the legalization of cannabis. I highly encourage you to hear them out and possibly sign their petitions. Also, with the changing times, there are more and more politicians running who see the benefit of marijuana. So please check them out and vote for them, and let's legalize it finally.